Hello and welcome to Chapter 1 of Anatomy and Physiology, Organization of the Human Body. Before we get started, it would be helpful if you have your textbook handy, so this way we can read it together. And also if you have the reading guide. Now, reading guides can be found on the left-hand toolbar under Reading Guides. So what we're going to look at in this chapter is basically first off, what is anatomy and physiology? Then we're going to look at the organization of the body in terms of different levels. Then we're going to look at all the terms for directions, planes, positions, regions, cavities, and then we're going to look briefly at homeostasis. And homeostasis is one of the key terms that we'll be going through most of the course. Homeostasis, which is the state of staying normal when you're changing. Okay, so we have that. So first thing, textbook. What is anatomy and physiology? Whoops, my movements are too big here. So anatomy, and here's an example of how the textbook has some bolded words, which is good, but sometimes it also has stuff in a paragraph that that's important, but it doesn't actually stand out. So first off, anatomy is the structure. What is it? Name that part. And physiology is how it functions. And quite often you'll look at how the function is based on what it looks like and the structure of it. So we're looking at form and function. Another thing we'll get into, or you'll get into in later classes, is pathophysiology. Patho is disease, and physio is the study of living things, and ology is study. So pathophysiology is how disease affects disease affects functioning. Now, this course is full of big words, piles of them, and I think they're very cool. However, please realize that big words are found and are made of little parts. So if you look at the little parts, you can get an idea of what the word is at least about so you're not getting intimidated by the big words. Okay? And we'll focus on those as we go. Now, organization. The body at work of the body is fascinating. There's all sorts of art books about it. Different levels. It's been studied for years. So let's look at what's called the organization of the body. Now, the body is made up of atoms. Atoms are the smallest unit of matter. And what atoms are is you've got your elements, and you've got your atoms have protons, neutrons, and electrons in them, and they go together. Depending on the interaction of these atoms, you will get molecules, and molecules will then start with create various substances, and those substances create structures. The main molecules we're going to look at is water, proteins, fats, carbohydrates, and nucleic acids. We'll look at those when we get to them. Then an organelle. An organelle is a bit. So organ is, you've seen the word organ, but E-L-L-E, it means little. So an organelle is a little unit inside the cell. And these are the parts of the cells, which is the mitochondria, the nucleus, the ribosomes, stuff like that. Then when you put these organelles together, it always amazes me how you can take this matter, this unliving stuff, and then you put it together and you get a living cell. And cells are the smallest unit of living units. Sorry, the smallest living units. Then cells group together to form a specific task called a tissue. Then tissues will group together to create what's called an organ. And an organ is a group of tissues carrying out a particular function. So if we go to cells, here we have this is a columnar cell. Here you form it's called pseudocolumnar, and then they will go together to form, it's more in the esophagus than the stomach, but cells work together to form tissues. Tissues work together to form organs. Then, next level, your organs will work together to form an organ system. And there are 11 organ systems in the body. We'll look at all of them, some in more detail than the other. So here's the digestive system, and then the systems go together to form an organism. Okay, and that is the level of organization. Very good question to put in order. Also define, list from greater to smaller. So that would be kind of a question related to them. Now, when we look at organ systems, most of these are straightforward. And we're just touching on them briefly now, and we're going to go into more detail later. The integumentary system is skin and hair, and the main function is to cover and protect. So here we have protection, temperature regulation, water retention, and interaction. Your skeletal system is your bones, your cartilage, your ligaments, and the main function there, let me just pull this down a bit more. The main function there is to protect and support. Also to act as leverage, so for movement. And another thing you may not think about with the bones is blood formation. Your blood cells come from your bone marrow. Okay. Number 3, your muscular system, and your muscles are for movement, for posture, and for heat production. This is why when you're cold, you shiver. It's your muscles giving off heat. Good. The unloved one that most people don't think about, the lymphatic system. The lymphatic system is an extra set of drainage vessels, and their role is in fluid balance. The lymphatic system is where your immunity and your immune cells, your T cells and your B cells work. So you're producing your immune cells, and also since you're making your white blood cells, your lymphocytes, you will have fighting against disease. And we'll talk more about that when we get to respiratory system. The respiratory system is all the tubes to get to your lungs, and then the lungs. The whole purpose of the lungs is to get oxygen into your body and then take carbon dioxide out. In the process of moving carbon dioxide in and out, it forms a bicarbonate ion, which will then help in your pH balance of your blood. And also, as air comes out of your lungs, it goes over your vocal cords, and that's why you have speech. Good. Next one, urinary system. Your urinary system is a way to get rid of waste. So we're looking at excreting, well, everything goes in your urine. The way to look at your urinary system is it's a system to balance your blood, and then once your blood is balanced, all the extra stuff goes into your urine. You don't make pee for the sake of pee, but you make pee as sort of the waste of your blood. So we're going to look at the excretion of wastes, maintaining blood volume, and also controlling fluid and electrolyte balance, and also helping with acid-base balance. So your respiratory system is a quick fix for your acid-base balance, and your urinary system is a slow, long-term fix. The nervous system will look at brain, spinal cord, nerves, the senses. Then it's control, regulation, coordination, sensation, and also memory. Your endocrine system is your hormonal system, and your hormones are slow messengers in the body, and the endocrine system will produce hormones, which goes into your blood, and it regulates. This one, we're going to get into more detail. It's quite complex because a lot of the words sound the same. We'll take it off. Then your circulatory system, or your cardiovascular system, heart, lungs, arteries, capillaries. The whole process of your circulatory system is to transport the nutrients and the good stuff, which is the nutrients and the oxygen, and also to remove your waste products, but also to circulate your immune cells and your hormones for signaling. Okay. Digestive system. Your digestive system consists of your stomach, large intestines, esophagus, liver, and pancreas, and it is also important in the breakdown and absorption of nutrients and the elimination of waste. Did you notice that the pancreas shows up here in the digestive system, where it's an exocrine organ, and the pancreas also shows up in the endocrine system? Pancreas is an amazing organ. Then we're going to look briefly at reproductive system, look at the male reproduction in terms of the production of sperm, and then the female reproduction in the description of producing egg and procreation. Okay, so that is the body at work when we're looking at the systems. This is just an introduction. you should have a general idea, but most of this is common knowledge already in terms of what goes where. Now, when we look at anatomical terms, when the body is referred to, it's always referred to as in the person you are observing. So the right is the right side of the person, not your right. And this is very common, very easily confused when we're talking about the heart, easily confused. So talk about right and left, referring to the person. Now, there's another word. Medial means towards the midline, and lateral means away from the midline. Also notice that this person is in what's called anatomical position, which means the hands are out and stretched with the thumbs pointed outward. And this is important because there's no crossing over of the bones. If you rotate your hand this way, your bones, your radius and ulna, are crossing over each other. Okay? So this is anatomical position. Medial means towards the middle. Lateral means away from it. A good example of that is on your ankle bone. Your medial malleolus is the one on the inside, and your lateral is the one on the outside. Distal and proximal, it's really good when referred to in the kidney. You've got your distal convoluted tubule, which means distant or furthest away, and proximal means close to or approximate to. Okay, so distal and proximal are paired words. Then when we're looking at superior is above, and it's paired with inferior, which is below. And we'll talk about the superior and inferior vena cava as the main vessels that go into the heart. Your anterior, it's a little confusing on hormones. Anterior is usually towards the front of the body, sometimes towards the head, and posterior is towards the back. Normally ventral is towards the stomach, and dorsal is toward the back. If you think of a shark, it's got its dorsal fin. It's a little confusing on humans because we stand upright. Okay? Anterior also has ventral. Dorsal is posterior. An example of this is on your hip bone, you have a posterior crest, and you have an anterior crest. Then we're talking about superficial and deep. Those are paired. Superficial means on the surface, and deep is away from it. And usually when we're referring to superficial and deep, we're looking at blood vessels, or we're looking at muscles. Okay? Now, the body is cut into sections, and as you cut it into different sections, you get different images. So an example here, this is called a sagittal plane, and in the sagittal plane, you are cut down with equal left and right. And this is really good to reveal organs in the head or the pelvic cavity. Other than that, it's not overly effective in humans, but it's a good way to look at things. Then you have a cross section. If you go transverse, you're going horizontal, and you end up with an upper and lower. And this is very common in a CT scan. And then you also have the frontal plane. So the frontal plane is very good for brain scans, especially. Okay? Good. Here's some examples of sections, and this is a section of the head. So let's do the easiest one we talked about, which is the sagittal section, which is down right through here. And as a result, you can see here's the brain stem. Here is the corpus callosum, which is the part that separates the left and right hemisphere. So that's a sagittal section. Very good to see the brain stem. Here's the cerebellum. Notice the elum at the end, which means little, and the cerebral cortex. Okay? Then if you take the horizontal, so this would be cutting this way, here you have a good example of the brain here. On a cross section here, you can see the eyeballs, and you can see here's what's called the ventricles in the inside where the fluid goes, and you can see the convolutions of the brain, and this would be of the cerebral cortex up here. Then you can also do a frontal image. So it's as if I were to cut it this way, and you can see a different variation of the brain. They're all really good to look at because this way you can layer them and get more information depending on the angle. Often when you go to get an x-ray, they will take an x-ray this way and then turn you sideways and take another x-ray as a result to put together the images. Okay? Okay, when you look at the reading guide, I've included this image. Chances are you should label this, and this way you'll know what they are. Plus, there's room here for notes if you want to write notes. Good. Next, we're going to look at other things to do with words, and that is the area words or the body regions. Now, it sounds like it's really tricky and hard to look at. Most of it makes sense, and as you learn it, it'll help layer things because it makes more sense in terms of naming your blood vessels and your muscles and your nerves. So an example of your blood vessel is your radial artery, which goes here. Or let's go with your brachial artery. Your brachial artery goes down your arm. Your axillary nerve is in your armpit. Another example, inguinal. If you have an inguinal hernia, you have a hernia in your groin. There is, you need to practice this. I will try and find a drag and drop, which I will use for, I'll use on our session. So hopefully we'll go through that. Please take the time to learn every one of these. And again, some of them sound tricky, but if you think about it, most of you already know common things like femoral area. This is where the femur is, which is the large bone of the leg. So this is a femoral area. You might know that your knee bone is your patella. So this is your patella area. You may have talked about pubic hair. So this is the pubic region. Your pelvic girdle is your pelvis. Your orbits, your eyes. Anyway, very important. Take time and go through them. And yeah, take time and find right now. So you've got your cephalic, which is your head. Your cephalic artery is the artery that goes to your head. That's all I can think of. Your frontal, this is your frontal bone. Nasal, oral, deltoid, axillary, brachial. Then you've got your antebrachial. So your brachial is the top of your arm. Your antebrachial is the bottom of your arm. And then you have your cubital fossa and your antecubital. So your antecubital fossa is this little dip here. And that will become quite important because a lot of injections are given in your ACF, your antecubital fossa. Okay? Good. Carpal, you may have heard of carpal tunnel syndrome. The carpal is your wrist bones. Palmar, sounds like palm. Digits are your fingers, so you may have had a digital examination where they take your fingers and put it in a hole. Okay, buccal is cheek. I don't know if you've paid attention when you're at the dentist, but the dentist will talk about a lingual and a buccal side. Okay, then you've got your cervical. When you talk about your thoracic is your vertebrae, your pelvic. Mammary has to do with breasts. Abdominal, pelvic has to do with your pelvis. Okay, now when you look at your feet, you've got your tarsals, which are your ankles, and your pedals. So if you think of you put pedaler, your pedal, you use your feet to pedal a bike. So that's how I remember that one. Okay. Cranial is the back or surrounding the brain. Otic is an otoscope, is what you use to look at your ear. Your occipital, you've got your occipital condyle is where your head sits. Scapular is where your scapula is. Your vertebral column. Your lumbar is your lower back. Sacral has to do with your sacral vertebrae. Gluteal is your buttocks. Peritoneal is the area in between your urethra and your anus. Popliteal, I like that one. Popliteal is the back of your knee. So that's one you might not know. Calcaneus is your heel, and plantar is your sole of your heel. Okay. This video is getting a little long, so I'm going to end it here, and I'm going to continue with the second video.